All right. So we have Dr. Bill Liu. He's a PharmD and BCGP, which means that he is a board-certified geriatric pharmacist, and he currently supports the County of Orange Healthcare Agency Older Adults Program, their behavioral health program in particular. He obtained his undergrad degree in pharmacy from Washington State University, and he is a doctor of pharmacy from the University of Southern California. Bill gives presentations on medication topics to groups of seniors in the community and to senior service providers throughout Orange County by appointment. He meets one-on-one with seniors to review and assess the medications, vitamins, and nutritional supplements they are taking. So Bill brings in a lot of experience, and he is an excellent speaker. Bill, go ahead.
Thank you so much, Sayeda. Can everybody see my slides?
Yeah.
Yes, we can.
Very good. I'm so pleased to be invited by Sayeda to speak to this group again. And I hope my presentation will open your eyes a little bit about this very important hormone that circulates in our bodies. My goal of this presentation, let's see here, I'm trying to advance my slides. Okay, my goal today is first to talk about the anatomy, which is the structure of this thyroid gland. Then we'll talk about the physiology, which is the function of this thyroid gland. What does it do? And then we'll talk about some common thyroid diseases, because when we talk about that, it will highlight what this organ and its hormones can do for us. Okay. So let's start with the anatomy. It's described as a butterfly-shaped gland that sits low on the front of the neck. And as you can see from that picture, why we call it a butterfly-shaped gland. The location itself is right below the Adam's apple, along the anterior of the windpipe, the front of the windpipe. And there are two large lobes on each side of the windpipe, connected by a little bridge. So that gives it that butterfly look. And when your thyroid is normal, everything is working well, you cannot feel it. However, as we discuss later, sometimes it will enlarge or it will have nodules, and then you can feel it. It's reddish brown in color, and it's very vascular. A lot of blood vessels go through it. And there are also very important nerves that travel nearby or through it. And that's why people who have thyroid problems sometimes will notice their voice being affected. So on the left, you'll see that outline of a human body, and you can see whereabouts it is, the thyroid gland, in relation to the rest of the body. So that was the anatomy. Let's now talk about the function, the physiology of this thyroid gland. Its main job is to produce the hormone levothyroxine, T4. Once that T4 is produced, the body will convert that T4 to T3. And between T4 and T3, three very important functions are carried out throughout the body, are made possible, really. Those hormones will regulate metabolism. And metabolism means when we change something in the body, either something existing in the body or something we put into our body, like through food, and we convert that to something the body can use, which is like energy, for example, when you're taking in food. Also, these hormones are extremely important for young children and for infants, really, and for even neonates starting right when they're in the mother's womb, when it comes to growth and development. And the third very important function is these hormones help to regulate body temperature. Because if your thyroid hormone is too high or too low, you're going to either feel very hot all the time or very cold all the time. Okay. And remember, we said earlier, it's very important for a mother who's pregnant to make sure they get adequate amount of thyroid, because of the development starts right in the womb with these hormones. So now let's look quickly at some of the thyroid diseases, okay? And here is a list of the most common ones. First of all, goiter. That is a general term for when your thyroid starts to swell. Goiters can be harmless, or they can represent an iodine deficiency or a condition associated with thyroid inflammation called Hashimoto's. Actually, it's even more complicated than that, because a goiter can form if your thyroid is too high or too low, all right? And this is what it looks like. You can almost see on her neck there, the right side of her thyroid lobe. Remember, it's two lobes, one on each side. You can see that it's swollen up so large that you can actually see that right wing of that butterfly in her neck. And one of several types of growth in the thyroid gland is called goiter. And another disease that causes this commonly is Graves' disease. You might have heard of that. And that is due to an excess production of the thyroid hormone. Remember, the thyroid hormone, as it's trying to work very hard to produce your thyroid hormone, it's like any muscle. If you exercise a muscle too much, it's going to grow, right? So in this case, that's what's happening. The thyroid is being used so much in order for trying to compensate by producing more hormone that it starts to enlarge. And here's the big problem. When the thyroid is producing so much hormone, it's also going to affect other organs. For example, your heart. Your heartbeat starts pounding and can be really dangerous. Sweating too much, you can also lose weight a lot because you're metabolizing so fast. Your muscles will start to tremble and so on. So indirectly, it can lead to other very dangerous conditions if this is not treated. It can also affect the eyes. It gives you that goldfish eye look or the bug eye look, as if your eyes are going to pop out. It really won't pop out. It's really what's happening is the swelling of the eye muscles surrounding the eyeball, and that swelling causes the eyes to protrude forward a little bit. The medical term is exophthalmos, right? Goiter nowadays is not seen as much. Why? Because we pick up iodine so easily everywhere. When your iodine supply is adequate, you're going to form your own hormones more naturally, and you won't then have the thyroid overworking, looking for more iodine. So what happened was back in the 1920s and 1930s, a lot of people were walking around with goiter like this, especially in the inland parts of any country. In the US, it will be around, the inland Midwest, so to speak. Why? Because their diets had very little iodine, no seafood to speak of, and so on. And so what they did was they start iodizing salt, table salt. So when you buy salt today, you can look for salt with iodine or without. And if you buy the salt with iodine, that should take care of all your daily iodine needs. We'll talk about diet a little bit more in a little bit. Okay. Another condition is thyroiditis. And by the word ending in itis, tells you it's related to inflammation. So when the thyroid gets inflamed, either due to picking up some kind of virus or some autoimmune condition, autoimmune means that the body does not recognize one of its own organs and is starting to try and destroy it. And when it fights back, it inflames. The symptoms can range from pain in the neck to no symptoms at all. Okay. And the next condition is hyperthyroidism. We talked a little bit already about this, like in Graves' disease, but sometimes the thyroid gland just produces too much hormone. It becomes impaired, and the symptoms then can be very confusing with other conditions, because when you're producing so much thyroid hormone, your body becomes a little bit more active all the time. You're nervous, you're irritable, so you're tired a lot. You have trouble sleeping, muscle weakness. You cannot tolerate heat. While everybody else is looking for a sweater, you're feeling very warm all the time. You have very rapid or irregular heartbeat. Because your metabolism is going up so much, you will lose weight and you may have diarrhea. Back in the olden days, they used to give people who were obese, who were extremely overweight, thyroid pills to help them lose weight, but that's not allowed anymore because that is too dangerous of a way to treat obesity. Because if you give somebody too much hormone, they will lose weight, but they may also die from a heart attack because it will cause an irregular heartbeat. So that's not allowed anymore. Then there's the opposite condition, hypothyroidism. Oh, by the way, when it comes to too much thyroid, women are affected more than men. For every 100 women, there could be one with too much thyroid, but it takes 1,000 men to find one with too much thyroid. Okay. Too low a thyroid is a very common condition in seniors. Whenever I speak to groups, I ask, is anybody here taking thyroid because the thyroid is low? Almost always, 1 or 2 or 3 hands will go up. And here also, more women are affected than men. Almost twice as many, and in some populations, almost 8 times as many more women will have low thyroid than men. Okay. And low thyroid is also very difficult to diagnose, short of a blood test. That's the quickest way. Because if you look at some of these symptoms, it could be so many other different types of conditions. You'll also feel tired. Mentally, you may become depressed. There could be joint pain. There may be constipation. Your heart rate is very slow this time. Notice how some of these conditions are just the opposite of too much thyroid. You're afraid of the cold. You're always looking for a sweater. And of course, weight gain. Weight gain because you're not metabolizing food you take in fast enough, all right? Graves' disease, common condition we already talked about. It is usually autoimmune in nature, meaning that your body is destroying its thyroid gland by itself. And the thyroid gland is being overstimulated, and it overcompensates by producing too much thyroid hormone, okay? Thyroid cancer is probably one of the most treatable types of cancer. There are 4 or 5 different types of thyroid cancer, 1 or 2 of which are very deadly. The other remaining ones are very treatable, especially if caught in time. Okay. Now, thyroid nodules are when you can actually feel a little lump or a little ball or a little hardness around your neck area. And that is because you have a small lump or mass. Doctors can easily remove this with a little bit of surgery. Very seldom are they cancerous. They're usually benign. Sometimes they remove the entire thyroid, and that's no problem either. Why? Because we have very good medicine that gives you the exact amount of thyroid you need to replace your thyroid gland. And the last condition, it's rare, but it's very possible. It's called the thyroid storm. This is a life-threatening emergency. And this is when large amounts of thyroid are constantly being produced. And each time it comes out in a wave of high production, your heart cannot tolerate it. It starts to pound away. You go into rapid heartbeat. And that's what makes it a emergency, medical emergency. Now, let's look at some of the lab tests your doctor could run. Some of these tests are very sophisticated ones, like the thyroid scan or the biopsy, where they actually take a little piece of your thyroid out with a needle. But the 2 most common tests that if you get an annual physical, the doctor will almost always run them once a year. And that's one of them is called the thyroid stimulating hormone, the TSH test. If you all go back and look at your old lab tests, you can look for this test, the TSH. And I'll describe it more in just a minute. Or sometimes your doctor will run what we call the free T3 and T4 test to see how much of the 2 hormones do you actually have circulating in your blood. That will tell us, along with the TSH, whether you're producing too much or too little of the hormone, okay? And how does this hormone work? How does the body know how much to produce? Well, we have to go back into the anatomy a little bit and the physiology again and look at deep inside your brain. One of the most and very important and sophisticated part of your brain is called the hypothalamus. You see it there indicated. And this, he's like the big boss. He will produce the first hormone called the thyrotropin releasing hormone, the TRH. That hormone then tells the second gland in your brain, the anterior pituitary, which sits just below the hypothalamus. It looks like a little pea, like a vegetable, the pea. It will then, the anterior pituitary will take that TRH hormone that the hypothalamus produced, and it will authorize the anterior pituitary to then produce that TSH hormone. Okay, that's the thyroid stimulating hormone. Okay, and that's what your doctor is measuring. Why does he measure that? Because that TSH hormone, once it's produced, it goes into the bloodstream and looks for the 2 thyroid hormones, T3 and T4. Mm-hmm. If it finds a lot of T3 and T4 in the bloodstream, it will then try to disappear. The TSH will then go down to very low values to tell the brain that there's enough hormone out there, they don't need me. I don't need to stimulate the thyroid. Does that make sense?
Yeah.
Because why does it say I don't need to stimulate the thyroid? Because there's plenty of hormone around already. However, if the TSH, when it's released by the anterior pituitary, it goes into the blood, and this time the TSH realizes, wait a minute, there's very little T3 and T4 hormone around. That thyroid gland is not doing its job. So I need a lot of that TSH to go work on that thyroid gland, to wake it up and to tell it to, hey, go and produce more hormone. Don't be so lazy. Come on. Your body needs hormone. So the TSH, to do that job, needs to be higher in value. So far, so good? Yeah. Because you have to reproduce this chart for me in the tests that you will be taking.
Oh my God.
Just joking. No, but the easy thing to remember is they work opposite each other. When your doctor sees in the lab test he runs every year that your TSH value is very high, your doctor will say, oh, your T hormones, T3 and T4 must be very low, meaning you need treatment by giving you thyroid pills. However, when your doctor sees that in the blood test, your TSH is very low, extremely low, now your doctor worries and says, wait a minute, now your T3 and T4 hormones must be too high. I better look at the T3 and T4 hormones. I better keep an eye on your heart rate. I better do some other things. So far, so good? So that's the easy way to remember, that they just work opposite each other. And you don't, so these are the three hormones your doctor looks for. And some of the values I've listed here, these are approximately that because every lab has their own reference range or the value that it should be. And this is approximately where it's at. So in other words, if your TSH hormone is below 0.4, your doctor will say, wait a minute, your hormones must be very high already. Or if your TSH is very high, way over 5.5, your doctor will say, uh-oh, this person's TSH is very low. Your T3 and T4 is very low. So I'm going to have to prescribe some thyroid pills. And your doctor will confirm it by looking at the actual free T4, which is where our medicine comes from, which is, those of you who are taking thyroid know that the full name is called levothyroxine, which is T4. Or, and then he looks at T3 also and gives you that too, if necessary, okay? And so these T3 and T4 that we're talking about, why do we call it T3? For example, well, look at here. There are 3 iodine atoms on every molecule of your T3. That's where we come up with the 3. So it takes 3 iodines to make 1 of the T3, okay? What about T4? Can you guess how many iodines it will take?
4.
Very good, there's the 4. It will take 4 iodines for T4. So what is the moral of the story? The moral of the story is taking an adequate amount of iodine is important. However, we don't want to overdo it either, because too much iodine or too little iodine in your diet can affect things, all right? So we want to just eat normally, but eat healthily, because in adults, all you need is 150 micrograms. That's very, very small.
Yeah.
And you can easily pick it up from food. women who are breastfeeding, they're infants or they're pregnant, they need more during their pregnancy or during their lactating period. Why? Because the infant needs a lot of iodine to develop normally, okay? And what are some of the foods that are rich in iodine? Well, here's just a very small example. You see that seaweed, just one serving of 10 grams will take care of more than all the iodine you need in a day. Certain breads made with dough that has iodine in it. Seafood, like cod. Cod is a very good fish that will give you not only the fat that's good, like the omega-3s, fish oil, but also it has plenty of iodine. 1 3-ounce serving will take care of all the daily iodine that you need. And you can see as you go down the list here, by eating a combination of these things, you have taken care of your daily need for iodine. And if you happen to be using iodized table salt, remember when you buy salt, you can buy it with or without iodine. Well, just your daily sprinkling of that in your food, if you don't have high blood pressure, will take care of almost all your iodine needs, okay? Now, when it comes to treatment for the thyroid problems, surgery is certainly one option that some of your doctors will go to. And then, like I said earlier, it's no problem when your thyroid is removed, because then all you have to do is take the thyroid hormone in pill form. And if you have too much thyroid, another option we can do is give you medicines that will lower the thyroid hormone. Sometimes they will use radioactivity to stem the production a little bit, like radiation. Or they can use recombinant human TSH, which is actually giving you the TSH. Your doctor will determine what is the cause of your high production or low production of thyroid to decide which therapy to go for. But if he decides to go with a pill, the medicine for too much production of thyroid hormone, we have 2 very effective drugs. Although nowadays we don't like to use the second one too much, propylthiouracil, because we know it damages the liver more. We'd rather go with the first one, methimazole. And if your thyroid level is too low, we have very good and very accurate ways of replacing your thyroid hormone by using medicines like this. Levothyroxine being the most common one. And the reason I show you the picture of all those pills is because treatment of thyroid is a very exacting science. Sometimes your primary care physician will send you on to the endocrinologist, who is the expert on treatment of this type of condition. Most of the time, your primary care physician can handle it, but sometimes for the very rare conditions, or if he is puzzled, he may send you on to the endocrinologist. And one reason is, look at the pills. They're separated in strength by very little. So in other words, sometimes 75 micrograms may not do the job. We need to increase it by 13 micrograms to go up to 88, or to go up from 88 to 100. And that's only 12 micrograms. A microgram is 1,000 times smaller than a milligram. Okay, is anybody here taking medicines like for high blood pressure? We measure that in milligrams, and that's already very small, and we cannot see that with the naked eye. In thyroid cases, you're dealing with amounts 1,000 times smaller even. So you can see that the margin of error is extremely minute. So it's so important that your doctors give you the right amount, because too much or too little can cause all kinds of problems as well. And then when it comes to taking levothyroxine, because the amounts you're given are so small, it is very important to take it properly. In other words, it should always be taken on an empty stomach, at least 1 hour before you eat. And usually we like to give it to you in the morning, because that mimics the body's pattern better, because our bodies produce more thyroid in the morning. So early morning, empty stomach with plain glass of water. You certainly don't want to take it with a glass of milk, because the calcium in the milk will bind to some of that thyroid in your pill, that you're not going to get the best maximum effect. So empty stomach, plain water, at least an hour before you eat your breakfast. That's the way to get the maximum benefit of your thyroid pill. Now, here I'm going to describe some conditions to show you why your doctors have a tough time sometimes figuring out what the condition is. Look at these descriptions. A 72-year-old woman with a fluttering of the heart and vague chest discomfort on climbing stairs. Or a 65-year-old woman who has lost strength in her legs, causing difficulty in climbing stairs, and she had recently lost 15 pounds in body weight in spite of having a very good appetite. And an 84-year-old woman in whom a hand tremor has caused her to give up some of her favorite activities. So when you come in and you complain about these types of conditions, your doctor will probably draw blood, because in these 3 symptoms that are described, it is probably that you have too much production of thyroid, all right? One clue that gave this away is that loss in body weight, even though she's eating well. This probably means the body is metabolizing it so fast because she has too much thyroid hormone. And the hand tremor is another good giveaway of this type of problem. Now let's look at 3 conditions like this. An 80-year-old man with severe constipation who often falls asleep. A 75-year-old woman who has developed difficulty swallowing and a dry cough accompanied by hoarseness, weight gain, and dry, itchy skin. Or a 78-year-old man with hearing loss. All these are tied in now to too low thyroid. This is hypothyroidism. The big giveaway is that weight gain, difficulty swallowing, probably an enlargement there in that thyroid gland, and severe constipation, again, maybe attributed to low metabolism and falling asleep because of the extreme fatigue and not enough energy. Okay, so you can see that it is difficult sometimes to diagnose these conditions, all right? Okay, so are there any questions that you'd like to discuss?
I have a question.
Yes.
I take the levothyroxine, and is there something that you always have to take once you start, or are there ways that you can get off of it?
No, it's very unlikely that you will be stopping. It'll be the most likely thing is you will be on it. But what they might do from time to time is adjust the dose as necessary, but it's very unlikely that you will be stopping the thyroid.
So there's
But
nothing.
your doctor will be checking that annually, your blood levels, to make sure that he's got you on the right dose.
Mhm.
In fact, if you do feel abnormal symptoms of any kind, you should bring it up to your doctor, because like I mentioned earlier, if you're on generic levothyroxine especially, even the different manufacturers, when you change brands, the American Society of Endocrinologists, these are the real expert doctors, they recommend you get another blood test after 3 months of even changing brands, just to make sure that you're still in the correct range of that TSH value we talked about, and your free T3 and T4 are still being produced in the right amounts. Because we're talking about microgram doses, remember, so tiny that even a change in brand may not be releasing just the right amount.
Now, you said that you shouldn't, you take it 1 hour before eating, good, but you shouldn't take milk or calcium containing foods. How about other things? Are there other things you can take with it, or should it be, like I take a Claritin and I take them together. Is there a danger in, or should I be taking the Claritin at a different time?
To be perfectly safe, I would take the medicine by itself, to be perfectly safe.
Okay.
Now, for many medicines, the reason we make that rule of thumb is because it depends. Next time you may be also put on a blood pressure medicine. So you may then tend to start taking the blood pressure medicine with the Claritin might be okay, but the blood pressure medicine may not be. So it is, to be safest, take it by itself, just to be, to get the maximum benefit.
Okay.
So you get the full number of microgram dose that was prescribed. Okay.
Still, we have a question in the chat. What about Himalayan salt? Does it have iodine?
Does not.
About what? I'm sorry?
Himalayan salt. Does it have iodine?
What kind of salt?
Himalayan.
Oh, Himalayan salt. Yeah. No, I'm not positive, to be honest with you. All I know is that if you look at sea salt, it really has many other minerals with it, but usually not enough iodine. And I suspect Himalayan salt may be that way too. But to be safe, you should not be relying just on the salt content, right? On getting your iodine only from salt. You should also eat a variety of other foods that will contribute to getting the right amount of iodine in you. Now, why is it better to get it from foods of all kinds? Is because then you won't be getting too much from a concentrated source, like if you're relying only on salt itself. And definitely do not supplement with iodine unless you've been told to, okay? Because that would be too dangerous of getting too much iodine at one time, okay? Now, I don't know how many of you remember the San Onofre nuclear station that you could see when you were driving down to San Diego. Does anybody ever remember that? When you were halfway to San Diego,
Yes.
as you look on your right towards the ocean, you saw those old reactors. Yeah, since then they've closed those down. We don't use those anymore. But 30, 40, 50 years ago when they were in use, within a 50-mile radius around there, they would supply everybody with iodine in liquid form, concentrated liquid form, just in case they ever had a disaster in that nuclear site. Is because one of the radioactive nuclear elements that would come out of a nuclear disaster is radioactive iodine. And that will, if you inhale it or it gets into your body, that will go immediately to the thyroid. And before you know it, it will either kill you or you will get thyroid cancer for sure. So whenever if a nuclear disaster were to have happened back in those days, you were to immediately start taking that iodine supplement to saturate your thyroid gland so that now that radioactive iodine will have no room to go in your thyroid gland. This is just by way of interest, folks. Nothing like that can happen anymore because they don't have that San Onofre working anymore. Yes, ma'am. You need to unmute yourself. We can't hear you. Yeah.
Sorry. The T4 is converted into T3 by the body. The body converts the hormone into T3. And what is the function of T3 in our body?
Yeah, very good question. T3 and T4 need to work together. You need both. Why does your doctor not always give you T3, but he gives you T4? It's because it's simpler that way, right? If he gives you enough T4, your body then will convert it to T3. However, having said that, many people cannot make that conversion, and your doctor has ways of finding out. Sometimes he will look at the free T4 and T3. Your T4 is adequate, but your T3 is low because your body cannot make that conversion. But generally, your body can make that conversion. But if it cannot, no problem. We have T3 by itself as well that we can give you. It seldom happens that we seldom need to give you that, because if we give you enough T4, it will make T3 for you. But you need both for all those functions in your body to happen. Sometimes in the olden days, we used to give you the thyroid pill itself that used to be made from porcine source, from pigs. But frequently for cultural reasons, for religious reasons, but mainly for reasons of accuracy. Because once again, I'm going to bore you to death by telling you how small the amount of hormone is. So by giving you the thyroid pill itself that contains T3 and T4, but in much larger amounts, not exact because it's made from a source of another animal like the pig. We don't use that too much anymore. We prefer giving you the exact amount chemically made of T4. Because that amount is so small, we can make it very accurately. Did I answer your question?
No, I said the function. Suppose there is, I mean, why has God made this gland? You know, what is it? What is its function in our body?
Right. It all goes back to those three things, right? Metabolism, regulation of the body temperature, and also growth and development of certain parts of our bodies. And so you need both hormones to do that.
Okay.
It's a combination of the hormones. But like I said, most people think, and that's why you're asking that very good question, is why is it that most of us will only get T4? It's not because we don't need T3. It's because the body will convert the T4 your doctor gives you to T3. In very rare occasions, some people just cannot make that conversion. Then no problem. We can also give you T3. But why give you T3 when you don't need it? Because your body can make it for you from the T4 that the doctor gave you.
Right. And when we are taking our daily food, you know, we don't measure the iodine that is going in, you know, like when we eat our food, we don't measure it like that. We are taking fish, we are taking milk, we are taking all the food that contains iodine. So doesn't it, don't we take more of iodine? Like you say, it is in milli. I mean,
excellent question again. And Sayeda, I think you're a dietitian, right?
No, no.
Aren't you?
I have been.
Yes, I am.
Yes, yeah, correct me if I'm wrong. When you're eating foods, and especially a good variety, the body then takes what it needs and digests and eliminates what you don't need. In iodine's case, you don't have to worry that you're going to be eating too much of any one food to shoot over the daily requirement, because your body will eliminate what it doesn't need. It's water soluble. It does not store in the body. What I was saying earlier, when I gave you that example at San Onofre, when they used to mail out those free supplements to people living in a 50-mile radius, that you can get too much of because that's in very concentrated form. In fact, you only take drops of that in a glass of water. That's how you administer it, because it'd be too dangerous to take it, just by a teaspoonful and so on. Because then you're getting a bolus amount that your body doesn't have a chance to eliminate in time. But from food, that's a very natural way of doing it. Same thing, you can ask that very good question about vitamins, right? You can be eating certain foods. Can you ever get too much? Very unlikely. But you take a supplement of vitamin A especially, that is very dangerous because you're getting a concentrated amount, and that is fat soluble. The body does store, and it can slowly accumulate. But in iodine's case, when you're eating food on that list, and you've obviously overshot some of those by eating some of those foods, the daily requirement, no problem. Your body can handle that. Sayeda, please feel free to chime in.
Hi. Thank you so much.
That sounds right. You explained it really well. We have actually a lot of questions about food. What foods are good for supporting thyroid health? I know you mentioned them in your in your presentation, but if you could highlight any particular ones that are in a majority way.
Yeah, for the iodine content, was that the question?
Health.
Yeah.
For thyroid health, yeah.
Yeah, for thyroid health, it's seafood. Seafood of all kinds will really enrich the iodine source. And most of the time, short of an autoimmune disease or a virus that you may have acquired somehow, your thyroid problems are developed because it was poor in iodine, your diet. And so nowadays, that's really not as big a concern as it was in the last century. In the early part of the last century, people living in the landlocked states in this country, for example, in Iowa, they would worry about it. In Nebraska, you would worry more, because for them back in those days to get seafood was very difficult. Right. Today, if you eat, well and balanced diet with plenty of seafood, it's almost impossible to get a goiter due to lack of iodine. And an iodine-rich diet is the best way to promote a healthy thyroid. Short of what I said earlier, autoimmune diseases, then that's a different reason totally, or a viral infection of some sort, giving you a thyroiditis and so on. So the main reason for many thyroid deficiencies is a lack of iodine. So a diet rich in iodine is considered thyroid-rich food.
That's great. And then there's one more last question before we end today's session. Is selenium good to add?
Pardon me?
Is selenium good to add?
Yeah, selenium is an excellent antioxidant for many reasons. So if you have macular degeneration problem, or even a prostate problem in men's conditions. And, you know, selenium is a necessary antioxidant. But if you just eat properly, large, colorful fruits and vegetables, you will pick up all those good antioxidants like selenium. Sometimes your doctor will tell you to take a certain type of vitamin, like the ARIDS type of multivitamin for the eye, for example, and in it will have some of those antioxidants that you need. Or you can just take one good multivitamin with antioxidants, but I always couple that recommendation with the warning that don't ever let a multivitamin replace healthy eating. You still need to eat healthy foods, a good variety of it, colorful vegetables and fruits. That's very important. You don't rely on a pill for diet. The pill is only a supplement to help ensure it, but you still eat healthy. Because for one thing, the pill can't give you the fiber that you will need by eating healthy. And fiber is so important to maintain the probiotic microbiota in your gut. And so eating healthy can never be replenished by a dietary supplement.
All right. I think we have come to the end of this session. Bill, thank you so much. You were so knowledgeable and so helpful. It's always a pleasure to have you. And we will be seeing Bill multiple times this year for different topics. So look forward to his future sessions coming up in different, I haven't booked till the end of the year. So we'll be seeing him at multiple times.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.